Health Minister Dr. Zweli Mkhize has launched the National Department of Health budget for the upcoming financial year. It comes in at 51.46 billion rand. He joins us now from our Durban studios to discuss this. Minister, very good evening to you, and thank you so much for taking the time to speak to us.
Thank you very much. Good evening to all the viewers.
So let's start with this big cake of over 50 billion rands. Who gets the biggest share of it?
Well, it's largely divided across various programs that go to various provinces. There is quite a bit that goes for the infrastructure, that goes to deal with the rebuilding of hospitals, dealing with revamping old hospitals and so on. We call them conditional grants. Then there are other grants that we put for specific programs, such as programs to do with tuberculosis, to deal with HIV and AIDS, and dealing with other problems such as non-communicable diseases, cancers, and so on. So it's a whole variety of issues that we distribute the money for. But that is in addition to what the provinces would have themselves allocated to themselves. So it's a whole combination of work, because we do work between ourselves and the provincial governments.
Is there any one province which seems to account for the highest expenditure?
Well, Gauteng tends to have the highest expenditure, followed by KwaZulu-Natal, and then the others will follow. But the formula generally is structured on the basis of what the national government, national treasury does, which is called the FFC formula. This is the commission, Financial and Fiscal Commission, that determines what allocations goes to national, provincial, and then it actually then gets allocated into various departments. So depending on the size of the population, the nature of the problem, the burden of disease, and the size of the expenditure from the previous year, they tend to calculate from that point of view. So hospitals, big hospitals like tertiary hospitals tend to attract a lot of financing. So Gauteng, Western Cape, KZN tend to have that kind of situation.
So let's talk about the NHI bill that's to be tabled. It's in the phase of public consultation. I'm sure that is a big part of what you intend to do with your budget. So within the social compact, which emanates from the Presidential Health Summit, what are the priorities then for this financial year?
Well, last year the President had a whole consultative conference with various stakeholders. We counted over 250 stakeholders who participated. They range from professional bodies, regulatory bodies, goes to trade unions, goes to patients association, activist group, and patient associations, and private sector. Hospital associations, general practitioners associations. It's a whole group of stakeholders in health that came together to say we are all running one system, and it's got public and private, and therefore there are a number of issues that need to be dealt with. Amongst those are issues such as staffing, human resource issues, issues of the security of medication, supply of medication, issues such as the building of infrastructure, issues such as the building a stronger relationship between public and private healthcare providers, and the issues that relate to other problems of relating to stakeholders, how each of the stakeholders have to be brought closer to one another, and then of course the issues of training, nurses, doctors, etc., etc. So these tend to be the kind of priorities that we have to focus on to. So when we're going to be meeting with the President signing this social compact, is to say that each and every one of us is prepared to play our role in strengthening the health services, and also to how to take forward the National Health Insurance Program.
And that will occur within 9 pillars. So tell us a little bit more about that strategy of implementation.
Well, in this strategy, we have in the first instance got everyone having to come and sign on this weekend on the 25th, led by the President. Then the department largely is going to be implementing what is due on its side. So we have said, firstly, we have to also look at the issue of improving the financing of the health sector in general, because as you will know that on the public sector, the amount of expenditure is almost as equal to what is being spent on the private sector, and that is something that needs to be corrected, because the private sector is spending almost 175 billion rand, but it's actually on 15% of the population. So it means that the public sector does need to up its game and improve the funding on that side. Secondly is the issue of ensuring that we solve the problem of the shortage of staff, and in this case we have calculated that at the level of community health workers, we short of about 5,600 community health workers that we need to replace and make sure they're in position. About 4,000 nurses, 4,000 doctors that we have to, the vacancies that have to be closed and filled, and to ensure that all the doctors that are in community service are employed in the system, and the interns that are qualifying are absorbed in the system. So that's a second area of priority. The next area is the area of making drugs available in a way that is continuously supplied to all the patients that need them. And so there's a lot of work that's been done internally to ensure that we can track the production of drugs, the distribution of drugs to hospitals, to clinics, right up to the end where these drugs are actually received by patients. And this we are looking at technology to make sure that people can report immediately that there's a shortfall on certain drugs. Then we can activate the management to be able to correct that situation. We also want to be able to help to get people to get medication closer to their homes before they have to go to the hospital, because the large queues in hospitals are due to sometimes people who are just coming to get medication, but they are not sick. They don't even need to be seeing a doctor. So we will want to give attention to that aspect as well.
And Minister, no doubt this is a huge, Minister, this is a huge project, and it involves quite a number of facets to it. But funding is also a major issue, and you've spoken about the need for social solidarity. And I'm wondering if you talk about the public-private partnership, if ideologically you're really coming at this from the same place, because there are those who say, I'm not going to be funding the poor to have the same level of quality of healthcare that I am.
Well, the whole world is moving towards universal health coverage, which basically is based on social solidarity, where those who have got more resources make them available to actually cross-subsidize those who are poor. Those who are younger, who are less who are healthier, tend to then not to need too much of the attention of the service, will then subsidize the older. Those who are who are healthier, subsidize those who are sicker. And that way you are able to have a system where there's a pooling of the resources, and when the resources are pooled, we can then help individuals on the basis of the level of the sickness, and what type of sickness determines what level of treatment. It should not be that you go to a hospital where you're going to be seen by the specialist consultant. When you've got a headache, all you needed was someone to say to you, take this tablet, go and and rest. And therefore you find that people who could have been given lots of assistance for prevention, vaccination, health information, end up having to suffer from diseases which they need to be assisted, so that they don't have to end up with serious complications later.
Having said that, Minister, that's all well and good. Where's the financial risk protection going to come from?
Well, it comes from the fact that you pull all the resources into one pool, and then we'll create a structure that now determines that we will buy the services from all the practitioners, public or private, and therefore in every district we will then say, here is the amount of money, here are the numbers of people that need it. Therefore the teams of health workers in there will then treat people on the basis of the need, not on the basis of who's going to pay more. Once you change that approach, it basically becomes what we call capitation, which means you pay for the total number of people that you keep well, as opposed to treating people because they come back and pay more, investigating them, giving them a very expensive test because their medical aid is going to pay. We want to change that system because it's got a negative end.
Isn't that going to require a huge digital database? Obviously that will need people who run that, the resources. Where's that money going to come from?
Well, indeed, it will require that we must register all the South Africans as the recipients or beneficiaries of the National Health Insurance. And then we need to also digitize the records of the patient so that if a patient moves from Cape Town to Ga-Rankuwa, they can actually be detected in the system that is the same person and can be treated by the system at that kind of level. We will obviously need to raise more funds through various means, which are basically the state sources where the state knows how to raise the money through various taxations and so on. So all of those are the means that the government will raise the funds. Then, with all of that pulled together, you are then able to say some of the contributions that will come from employers, from individuals, will actually all come into this instead of money going to various different, separate medical schemes. It will go into this pool, but it still allows those who want to, on top of the whole package that the National Health Insurance will provide, they still want to run private medical aids. That's their own interest. But you will find that with time, there will actually be a very different platform on which people's treatment is offered, and therefore it becomes an issue where everyone generally cooperates with the system.
Minister, so fortunate. I wish we had more time. Lots to talk about. The Health Minister, Dr. Zweli Mkhize, in our studios there in Durban. Stephen, it's back to you.